Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hey, I am Dr. Callerina Woodard, and today we're going to be talking along the subject of supplements and nutrition. Specifically, we're going to get into what are the most common conditions that our patients are taking supplements for, and do they always need a supplement for that condition, or are there just lifestyle factors that they could start to incorporate that can start to declutter that medicine cabinet and save them some money on supplements? All right, so let's get into it. So today, like I said, we're going to be talking about nutrition and supplements, but more of a food and lifestyle first approach. I'm not anti-supplement at all. I'm more food, nutrition, lifestyle first based, because all too often I'll see patients come in that are taking a plethora of supplements, but they still are dealing with the same symptoms. And that's because they're not really looking at correcting the underlying issues, gaps, or holes in their physiology. They're just trying to supplement their way out of a problem. When it comes to what most people are taking supplements for, surveys show that it's going to be number one, general health. So feeling the gaps. And then also immune support, as well as energy or fatigue symptoms, joint pain and inflammation, heart health, and sleep. So these are the most common overall things, and I'm going to walk through each one of these. They're not even diagnoses. They're more just symptoms. And we're going to talk about what people are mostly taking, and then honestly what they could be changing in their just regular lifestyle that could help so much more with these symptoms. So we're going to start with general health. A lot of people are taking multivitamins, and then all these people that are listening to any health podcast is going to be taking some sort of green powder. When in reality, if they could have consistent whole food, high quality meals and rely less on ultra processed, we'll just call them ultra convenient foods, they could have so much more benefit from solely nutrition and lifestyle when it comes to just supporting their general health. Now, multivitamins and green powders, and I have talked about this before, our food is not what our food used to be. Our soil is not as rich in vitamins and minerals as it used to be. Our food, it's just hard. Most of us have to shop at a grocery store, and our food's been sitting on the shelf, so it's not as nutrient dense. So yes, I do understand where a lot of people need to take a multivitamin, but I also want people to understand that a multivitamin does not replace whole, clean, quality foods and consistent eating. That's a big thing. You're not going to get consistent nutrients if you're not consistently eating healthy. I'm really big on consistency here. So when it comes to the green powders, when it comes to the multivitamins, they're not bad. And I'm not by any means anti-supplement for any of these things. But I do want my patients to understand you don't have to worry about it as much, and you will support your overall physiology so much more if you focus on a food first, high quality food first approach. Think of how many nutrients you can get from a quality egg, or quality vegetables, or grass-fed, grass-finished beef. So much better digested as well to support your overall general health. All right, so next, let's talk about immune system support. The things that are most commonly taken with immune system, when someone starts to feel sick or snotty or run down, they're going to start turning to something like vitamin C, zinc, or elderberry. These are the things that are most commonly taken. When it comes to our immune system, it's so complex, and it actually is so much more than just thinking I'm getting sick or I'm getting a cold. But overall, when it comes to our immune system, the things that bog our immune system down are stressors. Stressors are going to make you way less resilient. And Dr. Greg said it first, and I love it's thoughts, traumas, and toxins. Stress is not just what's going through your mind. It's also what you're putting in your body. It's also what you're exposed to. These kind of things wear down your immune system because your immune system is going to prioritize survival over resiliency. Also, a low-calorie intake, just to dive deeper into the stress piece, whenever we do not eat enough calories for our demand, which oftentimes is the case. We yo-yo diet, or we just don't eat. Whatever we do eat is so low in nutrients, and we don't eat enough calories for what we're doing. Athletes, we see this a lot. We don't get enough amino acids. That's definitely going to impair your immune system production. It's also going to impair your gut lining if you're not eating enough essential amino acids in your diet throughout the day. And whenever we know this, we should know this, that most of your immune system is housed within your gut. So it's so important that we have a healthy, balanced microbiome for overall immune support. It's not, I'm sick and so now I need vitamin C, or I'm sick and I have a vitamin C or zinc deficiency. It's something is breaking down in my immune system. Stress is causing my body stress can be from even too much sugar. That was our big thing in the office, is people would talk about flu season. It's not flu season, it's pumpkin pie season, it's candy season, it's sugar season. Those kind of things lead to a very rundown immune system. So if our patients can understand that, yes, in an emergency, definitely support with vitamin C, zinc, elderberry. Again, I am pro these things, but always think I have to support the whole system. I have to make sure I'm feeling well, and I have to make sure that I'm supporting my microbiome, my gut. 70% of our immune system is housed in that gut. So if we can support that first, things like kefir's so good for overall microbiome balance. That's going to support your immune system so much more. But like I said, the immune system is very complex. This is just the picture we have to paint for our patients so that they better understand. Next, let's talk about low energy. Low energy and fatigue. We see a lot of B vitamins, a lot of caffeine, iron, and even mushrooms nowadays. Talking like adaptogenic mushrooms. Those are the supplements that I see most commonly in the grocery store, that are being marketed to people for energy and fatigue. And this is also a topic that is very complex whenever we're looking at energy. But under eating, same as before, low amino acids, blood sugar instability, dehydration, stress, chronic stress, leading to poor sleep, leading to poor melatonin production, blood sugar doing the same thing, will contribute to low energy and fatigue so much more than a vitamin B deficiency. I mean, all of these system-wide fatigue causers, the low protein, poor blood sugar stability, dehydration, and undereating, yes, that's going to cause you to possibly not absorb B vitamins as well, to not be able to consume B vitamins as well. But before taking B vitamins, we have to address the things that are causing overall fatigue. Caffeine, it's pushed a lot nowadays. We do want to see a natural cortisol awakening response for someone throughout the day. That's what's going to help them level out energy as well as possible. I talk to patients about this regularly. I tell them, before you drink your coffee, before you're going to drink your pre-workout, or whatever you're going to do in the morning, please consume some water and some food. Because if you do caffeine first, you're just going to push that cortisol spike a little bit higher. And it does typically, because most people nowadays do not have proper cortisol responses, it does make you dip and fall faster. Crash is what they call it, faster throughout the day. Iron, this is very common in women, that they'll take iron supplements, when honestly it's probably more of a nutritional deficiency or a gut issue that you're not fully supporting. And I've seen some good research on mushrooms, and I've heard great stories about people taking reishi, lion's mane. I know chaga is more for immune support, but different types of adaptogenic mushrooms. Again, if we support the system, we don't need those things as much. So we have to make sure we support the system that's going to support healthy energy rather than ignoring physiology and skipping straight to something we can buy off the shelf. Next, joint pain and inflammation. Turmeric, fish oil, and glucosamine are all great supplements. Turmeric especially with some kind of black pepper so that it can better be absorbed. They are anti-inflammatories. Fish oils, huge. Definitely have to make sure we're getting good omega-3s. Glucosamine, also great for joints. There are so many other supplements too that are good for joints, supporting the muscle, supporting the fluid around the muscle, and supporting your body being able to get rid of inflammation. But what actually leads to inflammation and joint pain, a lot of time it's dehydration. I've talked about this a lot. If your patient is not hydrated, and trust me, I've talked to so many patients about this. If your body is not hydrated, your body will prioritize blood volume over fluid around your joints. So if you're starting to get dehydrated, if you're not drinking well, we will rob from our joints to maintain hydration within our blood volume. Hydration's huge. That's why joints end up, as we age and we are more and more dehydrated, so our joints end up more and more dehydrated and more painful. So proper hydration is huge. Hydration does have a lot to do with stress. That whole aldosterone balance, cortisol pulling fluid and impacting our fluid balance, but also low amino acids. That's going to impair your collagen and tissue repair, your body's ability to repair these things. Low omega-3 intake, that's why people are supplementing with fish oil. And I understand not everybody is going to be eating the 3 to 4 servings of fish a week. So supplementing with fish oil and omega-3s will help with that. But also avoiding ultra-processed foods, which increase omega-6s, which increase inflammation. That's going to help your body overall heal from any type of joint injury or inflammation. Next is sleep issues. Most commonly taken are some sort of magnesium supplement, and I know I take magnesium every day. I am pregnant, I'm a mom, I deal with a lot of stress, and stress rips magnesium from our bodies, and our bodies have to hide magnesium. So I do talk about magnesium a lot with my patients, and I want them to understand there are different forms of magnesium. The best forms to take for sleep, for anxiety, for nervous system is magnesium glycinate, or I also really like magnesium threonate because that does cross the blood-brain barrier. Magnesium is taken, and as well as melatonin. We know melatonin is the referee when it comes to sleep. It's the one who starts the game. It's the one who gets things going. But there are also things that do contribute to poor sleep. There's blood sugar dips overnight. So blood sugar imbalances because you're under eating, because you're not eating enough carbohydrates to support serotonin production. When serotonin is not supported properly, that's going to impact your melatonin production. This also goes down to stress and how healthy carbohydrates support your thyroid, which also helps a patient better adapt to stress. But also high caffeine. Of course, if you're drinking high caffeine throughout the day, if you're one of those people that say, oh, I can drink a coffee at 5 o'clock at night and feel fine, you're in the minority. Most people do not metabolize caffeine that quickly, and that can impact their sleep, which if you're not sleeping well, or if you're taking even other things, THC, a lot of people have to do that, or drink a glass of wine or a glass of alcohol of some sort in order to sleep. That's impacting your body's ability to actually enter those deeper restorative forms of sleep. So that's going to it becomes a snowball effect on the rest of your physiology. So sleep issues is not because you have a magnesium or magnesium deficiency. A lot of sleep issues come down to your body not handling stress well and able to enter into that system-wide nervous system shut-off recovery phase. And heart health. We see a lot of these as people get older. I should have mentioned this with every other issue as well. Exercise and daily exercise, of course, is going to help with heart health, with immune system function, with energy and fatigue issues. It's also going to be great for general health and immune system health. We know that exercise is great, but when it comes to heart health, a lot of people are still taking omegas, your omega-3s, your fish oils, red yeast rice, CoQ10, and fiber supplements. And recently I went through a functional medicine course where we talked a lot about fiber and the benefits of fiber for not only heart health, but overall cardiometabolic and immune system health. So when it comes to what's driving poor heart health, a lot of times it's lack of exercise. It's whenever someone has lack of exercise, they typically get more plaquing from sugar because they're less metabolically flexible. Also an ultra processed diet, high with omega-6. Whenever we think about processed diets too, I want patients to understand this, even the healthy things with all the extra additives and preservatives and gums and flavoring, that impacts your overall health as well. Even if it's healthy, even if it says certified non-GMO there at the bottom, there are still additives and things that disrupt our microbiome, which gut health impacts immune health, gut health impacts overall health, gut health impacts sleep, gut health impacts heart health. It's all related, but these ultra processed diets, especially even if a patient's trying, they have to think what could be driving inflammation, which could be plaquing my arteries or glycating my red blood cells to increase my hemoglobin A1C to impact my overall health as well. So a lot of our ultra processed and we'll call them convenient diets where we can just run into a store, we don't have to make it ourselves. Those are typically lower in fiber. And whenever we have low fiber in our diet, that impacts our lipid metabolism. That's going to impact the LDL and HDL ratio. It's going to impact our blood sugar long term. Fiber really helps us break down carbohydrates and break down sugar and also detoxify our system for our overall health, but of course our heart health. So that's why fiber supplements we are seeing being pushed more for people with heart health issues. However, we need to take into account that you can get great fiber in a diet where you're also getting enough calories and other nutrients throughout the day and not just taking another supplement. So there are always patterns behind the symptoms, patterns behind the problems, different health systems coming from the same underlying issues that we need to have the conversations with our patients, which is things like undereating or only eating poor quality food or having blood sugar instability, which can be from frequently poor snacking, sodas throughout the day, sugary coffees, or blood sugar instability can come from a sugary breakfast and then no food until dinner time. That's going to cause blood sugar instability. Poor gut health from all the additives and even healthy foods, everything I mentioned from preservatives to gums to oils to all that kind of stuff impacting our gut health, as well as stress, thoughts, trauma, toxins, and then lack of exercise and chronic stress from work, chronically poor sleep. These are all things that are going to lead to those symptoms that people are most commonly taking supplements for. So before recommending another supplement or another herb or another adaptogen on top of supplements, we need to ask our patients, are you eating enough to actually support your physiology? Could most of your symptoms, could a big, huge amount of the support that you need come from fuel? Are you eating consistently, or is work getting in the way, life getting in the way, and you're skipping lunch, you're skipping breakfast, and then you're eating just 2 giant meals a day or 1 giant meal a day, and then those giant meals aren't nutrient dense? Are you having regular bowel movements? This is so important. I will talk to patients and try to uncover stuff and then find out they only have 2 bowel movements a week. Yes, you're going to be inflamed. Yes, your immune system is going to suffer. Yes, there's going to be a lot of underlying issues if you're not having regular bowel movements and regular exercise. So how do we start to declutter the medicine cabinet and ask, what does someone really need? Number 1, they need to be eating enough, especially essential amino acids, fiber-dense carbs, and omega-dense fats. Prioritizing their food quality. I know it's expensive, but it's worth it. and it will save you money in the long run on your health and on supplements if you're eating minimally processed whole foods. Having structured meals, so consistent timing of your meals, balanced micronutrients, having a supported digestive system, so eating slowly, being mindful when you're eating, applying adequate salt helps a lot, and chewing thoroughly. This is also going to help with hydration and electrolytes. So much more, dehydration is so much more related to just water, but also exercising regularly, and this involves strength, cardiovascular training, and mobility. Because if we want to reduce the reliance on supplements, we need to focus on building a stronger foundation. These are the things that build stronger foundations. I'm not saying everything has to be perfect. It just has to be consistent, providing your body with what it needs so that you don't have to take supplements for everything. Supplements support overall physiology. I don't want any patient to think that they can avoid the basic health things of exercise, eating well, sleeping well, and just take a supplement, and that's going to do it for them. But there are people who sometimes do need supplements for confirmed deficiencies, gut issues, or increased physiological demand like pregnancy. That's very hard in our nutritional world nowadays to get enough nutrients if you're a high caliber athlete, or you're pregnant, or you're digging yourself out of some kind of poor health hole. So these are the type of people that do need to be taking supplements, but the goal being that eventually they can take less and less supplements because they're able to get what they need through their lifestyle and their diet. And they're also able to support their gut health enough to maximally absorb the foods, the nutrients from their food. The most important thing to understand is that when it comes to physiology and supplements, that it's not that supplements don't work or supplements aren't helpful, is that we are all too often undervaluing the importance of nutrition and lifestyle. So as practitioners, we have to understand that and educate our patients on that. Understand that they need to know that lifestyle and nutrition are so much more important, and if we get those things right and support our physiology well, then supplements can do their job even better. I hope this helps. Enjoy the rest of your day.